everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have started discussing about the process of urinary elimination, where we have discussed about the urinary system and how does it function, as well as the act of urination, and also about the various types of specimen which we can collect depending on the diagnosis and also the condition of the patient. In this session, we are going to discuss about the urine specimen and culture. So why do we collect the urine specimen? We do it in order to perform various diagnostic tests so that we will be able to diagnose the condition of the patient. So what do we mean by urine analysis? A urine analysis, also known as the routine and microscopic, is the physical, chemical, as well as the microscopic examination of the urine. This urine analysis involves a number of tests which is done in order to detect as well as measure various compounds that passes along with the urine, and also it has been proven that this is a useful tool for diagnosing the condition of the patient since the earliest days of medicine. Here, just by collecting the urine specimen of the patient and just through the color, the odor, as well as the density of the urine, we will very much be able to reveal about the health status of the patient. So this is why the urine specimen is collected from the patient. So as this urine is collected, it is first assessed for its physical appearance, which is its color as well as the odor, right? So here, as we know that the color of urine usually ranges from pale yellow to deep amber in color. However, this color may change depending on the concentration of urine as well as the amount and kinds of waste which is present in the urine, because these also plays a major role in changing the color of the urine. It can either make the urine lighter or darker in color. Not only that, but presence of pigments and other compounds in certain food and medications can also change the color of the urine, as well as if there is presence of blood in urine, then you will find that the color of urine, instead of being pale yellow or deep amber, it can also be red in color. And also during a flare-up of chronic nephritis, the small number of red blood cells which is present in the urine can also give a smoky appearance to the color of the urine. So here, depending on the condition of the patient, depending on the concentration of the urine, of the various kinds of waste which is present in the urine, as well as the pigment and compounds which is present in certain food and medication, the color of the urine can also change. Now, when we talk about the odor of the urine, here, normally urine does not have a very strong smell. However, when urine stands, the composition from the bacterial activity can also give an ammonia-like odor. Not only that, but consumption of certain foods such as beetroot and asparagus can also impact the characteristics of odor of the urine. As well as if a person is suffering from any urinary tract infection, then it is quite common that there will be a presence of foul smelling odor. So as I've said, that the urine will be first assessed for its physical appearance, which is for its color and odor. So here, if you find that there is any abnormality in the color, as well as if the odor is not normal, then this can serve as an indication that the person is suffering from some diseases, and by performing various laboratory assessment, we can then diagnose the condition of the patient through the urine specimen. And here, once it is done, then it is the responsibility of those to refrigerate the urine sample if it is not to be examined at once. So now let us discuss about the types of urine specimen which can be collected, where we will come to know why is it collected, what is the purpose, what are the various assessment which can be done through the collection of this type of urine specimen, as well as what are the various steps you need to advise the patient to perform while he or she is collecting collecting the urine specimen through this method. So starting with the first one, which is the random urine sample. As we have also discussed about this in our previous session, I've told you, right, that this is a sample which can be collected at any time of the day. And also this type of specimen is most convenient to obtain, because here, as we have discussed about the fasting urine sample and all, right, where the patient must not eat anything, or he must collect it at the beginning, like at the start of the day, as soon as he gets up from bed. So that may be a little difficult for you to determine whether he has really done it or not. But here, when we talk about the random urine sample, here it is very easy, it is very convenient, because it can be collected at any time of the day. Either you have had a food, or you have not, or it is not necessary that you must collect it only in the morning or night, but as I've said, right, any time of the day. So this is the reason why this is the most convenient one. And also this type of sample may be used to detect the presence of various substances in the urine at one particular point of the day. And also this type of sample may be used to detect the presence of various substances in the urine at one particular point in the day. And also, while collecting this sample, no special handling is required. So here, what are the various equipments which you must provide to the patient for collecting this sample? Here, you must make sure that you provide a clean and a dry container with a lid, cotton ball or towel, as well as the laboratory request form. So when you are providing these equipments to the patient, you must make sure that you instruct the patient that they must use the cotton ball or the towel to clean the urethral area thoroughly in order to prevent any external bacteria from entering the specimen. You must advise the patient to void in the container, and once they have voided and handed the specimen container to you, you must make sure that you label it with the patient identifying information and send it to the laboratory immediately. Because here, a delay in examining the specimen may cause a false result when the bacterial determination are to be made. And once this is done, you must make sure that you wash your hands, as well as instruct the patient to wash their hands as well, and then note that the sample has been collected. So this is what you must do when you need to advise the patient to collect the random urine sample. Now moving on to the next, which is the midstream or the clean catch urine specimen. Here, this midstream or the clean catch urine specimen is the most common method of obtaining the urine specimen from the adults, particularly from men, because this method allows the specimen, which is not contaminated from the external source, to be obtained without catheterization. And here it is also very important to follow the clean catch protocol in order to have an accurate results from an uncontaminated sample. Here, the main purpose of collecting the urine through this method is to prevent the germs from the penis and the vagina from getting into the urine sample. And this is also a method which is done in order to collect the urine sample for the performance of various tests, such as the urine analysis, the cytology, and also for the urine culture. So what are the various equipments which will be required for this procedure? Here, we will be needing a sterile specimen cup, Zephyrin, a soap solution, or 3 antiseptic towels. And if we are providing Zephyrin or soap solution, then we also need to provide 3 cotton balls in order to use with the Zephyrin or soap solution. And we will also have to provide the laboratory request form. So what are the various equipments which will be required? Here we will be needing a sterile specimen cup, Zephyrin or soap solution, or even 3 antiseptic towelettes. And if we provide Zephyrin or a soap solution, then we should also provide 3 cotton balls in order, to be able to use with it. And then we will also be requiring the laboratory request form. So before you advise the patient to perform this midstream or the clean catch urine specimen, you should make sure that you prepare them for this procedure. And how can you do this? You can do this about what they must do when they are collecting this specimen, because here, as we have discussed in our previous session, that for collecting this specimen you need to advise the patient that he must first void the urine in the toilet, in the bedpan, in the urinal, and then he must collect a portion of the midstream urine in the sterile container which we will be providing for them, and then again allow the rest of the urine to be passed in the toilet. You must also discuss that this is done in order to detect the presence or absence of any infecting organism, and therefore must be free from the contaminating matter that may be present on the external genital areas. So if this has to be done for a female patient, then here you must make sure that you advise them to first wash their hands with soap and water. Then you must advise them to clean their perineal area with towelettes or even with cotton balls. You must advise them to separate the folds of the urinary opening with their thumb and fingers and clean inside with the use of the towelette or the cotton balls. And you must also instruct them that while they are doing this, they must use the downward strokes only, and they must also keep their labia separated during urination. And once this is done, then you must tell them to collect the midstream urine. As I've told you that, you must tell them to first void the urine in the toilet, then they must collect a portion of the specimen in the sterile container which we'll be providing for them, and then again they can pass the remaining urine in the toilet itself. And why do we do this? Why do we collect this midstream urine? We do this because the midstream urine is considered to be the bladder and kidney washing, and it is also this portion that the physician wants to be tested. And once this is done, you must make sure that the patient hands over the specimen container to you, where you must label it with the patient identification and then fill out the laboratory request form completely, after which you must send the specimen to the lab immediately. Because as I've said that a delay in examining the specimen may cause a false result when the bacterial determination are to be made. And once this is done, then you must make sure that you wash your hands, as well as instruct the patient to wash their hands, and then you must note that the specimen has been collected. And while doing this, you must also record if the patient had any difficulty during the collection of this specimen, as well as if there is any abnormal appearance in the urine. So this is for a female patient, right? When it comes to a male patient, when they have to collect this clean catch or the midstream urine, you must again tell them to wash their hands with the use of soap and water. You must instruct the patient to completely retract their foreskin and clean the penis with the use of the cotton balls or the towelettes. Then you must instruct the patient about how he can collect his specimen, that is how he can collect this midstream urine. And once this is done, you must again make sure that the specimen container is handed over to you, where you need to label it with the patient identification data. You must completely fill the laboratory request form, and then you must immediately send it to the laboratory. And once all of this is done, then you must wash your hands. You must instruct the male patient to also wash their hands, and then you must note down that the specimen has already been collected. And again, here you must also record if the patient had any difficulty in collecting the urine, or if there is any abnormal appearance. So this is what you must instruct the patient to do when they are advised to collect the clean catch or the midstream urine specimen. The next is the time urine specimen, which can be 2-hour, 4-hour, or even a 24-hour urine specimen. Here, for performance of many urine chemistry procedures, the specimen of choice is the 24-hour urine specimen, and it always begins with an empty bladder so that the urine collected is not left over from the previous hours. And this specimen also shows the total amount of waste that the kidney are eliminating, and also the amount of each. The main purpose of collecting this 24 hours urine sample is to assess the kidney function, as well as to detect if there is presence of any diseases. So here the equipment which will be required consists of a large clean bottle with a cap or a stopper, a measuring graduate, a bedpan or a urinal, the refrigerated storage area, as well as the gloves. And before you advise the patient to collect the specimen, you need to make sure that you prepare the patient. And since this test does not require anything other than the normal urination, so here there are no risks involved, and generally the patient will be given with one or more container in order for them to collect as well as to store the urine over a 24-hour period. So before you provide this container to the patient, you must make sure that you label the container with the patient identification data, the date, the time, as well as when will this collection begin and when should it end. And you must also instruct the patient that whenever they urinate, they must make sure that they flush down the urine down to the toilet when he gets up at the morning. And after this is done, then he can then start collecting the urine in the special container which has been provided to them for the next 24 hours, and also store it in a cool environment. This can be kept cool in the refrigerator or on ice in a cooler. You must also advise the patient to drink adequate amount of fluid during the collection period. You must emphasize on the proper hand washing before and after the collection of the specimen, as well as you must record each amount on the intake and on the output sheet. So exactly 24 hours after beginning the collection, you must ask the patient to void because this will complete the specimen collection. And also instruct the patient that they must always keep the container in a cooler environment until it has been transferred to the laboratory. So here, once this container is sent to the lab, we must also send the laboratory request form along with it. So these are the various steps that you must advise the patient to follow when they have to collect the time urine specimen. The next is the pregnancy urine test. So here a pregnancy test is done in order to measure a hormone in the body called the human chorionic gonadotrophin, which is commonly denoted as the HCG, because this is a hormone which will be produced during the pregnancy. This hormone can be detected in small amount either in the urine or in the blood of a pregnant woman as early as the 10 days after conception. So this test is mainly done in order to determine whether a woman is pregnant or not, and the best time for the pregnancy test or for performance of this test is after she has missed her period. So for the collection of this specimen, we only require the urine specimen cup. So here, as I've said, that this is mainly done in order to determine whether the woman is pregnant or not, and this is best done after the woman has missed her period. However, you must allow the patient to wait for at least 1 or 2 weeks after she has missed her period in order to get the most accurate result. However, you must keep in mind that irregular period as well as miscalculation of when a period is due can also affect the test. Because according to FDA, 10 to 20% of women may not be able to detect their pregnancy by testing on what they believe to be the first day of their first missed period. This is why it is very important that before we advise her to collect this specimen in order to be able to determine whether she is pregnant or not, it is very important that we must tell them to wait for at least 1 or 2 weeks after their first missed period. So in order to be able to determine the pregnancy, you must make sure that you advise that woman to take the test the first time she urinates after waking up, because this is the time whereby the urine will be concentrated and it will also contain the highest HCG level of the day. Why? Because the urine will become more diluted as the patient drink liquid. So here the HCG level may also become harder to measure later during the day. That is why in order to get an accurate result, you must advise the patient to take the test the first time she urinates after waking up. And once this is done, you must make sure that you collect the specimen cup, you label it with the patient identification, and then you must fill the laboratory request form requesting for an HCG test, and then send both of it to the lab. And here it is also very important that only the physician or a registered nurse must tell the result to the patient. So these are the various things that you must instruct the patient to do when she has to collect this urine specimen for performing the pregnancy test. So now we have come to the end of this topic, whereby in today's session we have discussed about the urine specimen and culture, where we have discussed in detail about the random urine sample, about the clean catch or the midstream urine specimen, about the 24-hour specimen, as well as the pregnancy urine test. So here we have got a clear idea, right, of what is the purpose of collecting this specimen, as well as what are the various steps that we must advise the patient to follow when they are to collect the specimen. So I hope you have got a clear understanding of this topic. I will be meeting you in another session. Until then, have a good day. Thank you.